This in-service video will provide you with basic instructions on using the Endo GIA reloads with tri-staple technology and Endo GIA Ultra Universal Staplers from Covidien. Always refer to the instructions for use packaged with the product for complete instructions, indications, contraindications, warnings, and precautions. The Endo GIA reloads with tri-staple technology are shipped sterile with 6 units in each box. The Endo GIA Ultra Universal Staplers are shipped sterile with 1 unit in each box. Each Endo GIA reload with tri-staple technology sterile pack and Endo GIA Ultra Universal Stapler sterile pack has a patient label on the packaging for recording of each instrument used. Each label mentions the code, lot number, and expiration date of the instrument within the sterile pack. Steps to use. The sterile blisters for Endo GIA reloads with tri-staple technology and Endo GIA Ultra Universal Stapler are designed for optimum safety and removal of the device when required. Endo GIA reloads with tri-staple technology packaging is easy to read and clearly identifies the contents. The length of the reload, 30, 45, or 60 mm, intended tissue thickness range, vascular medium and medium thick and articulating, are clearly marked on the packaging label. The packaging of the Endo GIA Ultra Universal Stapler also identifies the contents clearly. The size of the stapler handle, whether universal short, universal standard, or universal extra long, is clearly marked on the packaging label. Upon opening of the sterile blister pack, the reload is easily removed by the scrub technician. You will see a number of visual indicators on the device. There is a load arrow to help show you where to align the reload to the stapler handle. The reload also indicates the intended tissue thickness range, whether it is articulating, and the length of the linear staple line. Endo GIA reload with tri-staple technology is marked with the word tri-staple on the top of the anvil to help distinguish it from the Endo GIA Universal Reticulator and straight reloads. You will notice that in this reload, the anvil is the fixed component and the cartridge is the moving component of the reload. This is different from Endo GIA Universal Straight and Reticulator reloads, where the cartridge is the fixed component and the anvil is the moving component. To assemble, align the loading arrows on the reload and stapler handle. Insert the reload and rotate it clockwise with respect to the stapler handle until an audible click is heard. When properly loaded, the light blue unload button is properly seated in place, without showing any red coloration underneath. Remove the yellow shipping wedge. You will notice the shipping wedge is different from the Endo GIA Universal shipping wedge, but will remove as easily. Cycle the instrument to check the reload has been loaded correctly. Squeeze the loop handle once to close the jaws of the reload. Push the loop handle forward to confirm that the reload jaws will fully open. Proper action of the instrument will indicate it has been loaded correctly. The new Endo GIA Ultra Universal Staplers are 12 mm instruments and also are compatible with all the 20 Endo GIA Universal Reticulator and straight reloads currently available. Additionally, the new Endo GIA reloads with tri-staple technology can be loaded onto the Endo GIA Universal Staplers. This allows our customers versatility of using new and current technology as they see convenient. The new Endo GIA Ultra Universal Staplers offer our customers enhanced tissue manipulation and handling. As the jaws are closed to pass through a port or percutaneous incision, the jaws of the reload can be opened by pushing forward the black loop handle. You do not need to pull back on the black return knob to open the jaws prior to pressing the green Ready to Fire button. This function can also be a benefit if grasping is needed. The Endo GIA Ultra Universal Staplers offer more intuitive articulation, allowing a natural ease when operating. As you articulate left with the articulation knob, the reload will also articulate to the left. The instrument shaft rotates 360 degrees and articulates to 5 positions in both directions, for a total of 11 stops with use of the articulation mechanism. Endo GIA reloads with tri-staple technology offer enhanced stapling benefits. The reload offers a higher clamping force. The progressive closure technology provided by the fixed anvil and stepped cartridge face of the reload encourages both lateral and distal hydraulic displacement during clamping and firing. Also introducing Endo GIA curved tip reloads with tri-staple technology. Covidien has innovated these specialty reloads designed for enhanced access and visualization, tissue mobilization, and blunt dissection. Endo GIA curved tip reloads are supplied sterile in an easy-to-open blister pack. The blister pack contents include one Endo GIA curved tip reload and a flexible introducer. Endo GIA curved tip reload with tri-staple technology packaging is easy to read and clearly identifies the contents. The length of the curved tip reload, 30, 45, or 60 mm. Intended tissue thickness range, vascular medium or medium thick. And curved tip articulating are clearly marked on the packaging label. You will see a number of visual indicators on the device. There is a load arrow to help show you where to align the reload to the stapler handle. The reload also indicates the intended tissue thickness range, curved tip articulating reload, and the length of the linear staple line. Endo GIA curved tip reload with tri-staple technology is marked with the word tri-staple on the top of the anvil to help distinguish it from the Endo GIA universal roticulator and straight reloads. You will notice that in this reload, the anvil is the fixed component with a gold-colored curved tip. Endo GIA curved tip reload with tri-staple technology is similar to a Kelly clamp for blunt dissection. This may give greater control and visualization when transecting vascular pedicles. The curved tip allows confirmation that you have cleared the vessel and is of gold color for greater identification. The curved tip reload can be used with or without the flexible introducer provided along with the reload. Surgeons may mount the introducer on the curved tip and use it to guide the anvil underneath the vessel tissue that is to be transected. The introducer, once seated, will remain in place but can be removed manually and remounted again. The curved tip reload loaded onto the Endo GIA Ultra Universal Stapler or Endo GIA Universal Stapler can be passed through the port with or without the flexible introducer mounted onto the curved tip. When firing the curved tip reload, ensure that the tissue or vessel to be transected does not extend beyond the black cut mark on the reload. Apply the Endo GIA Ultra Universal Stapler across the tissue to be transected. Close the jaws of the stapler by squeezing the loop handle completely. If you need to reposition the stapler, move the black loop handle forward to open the jaws and reposition the stapler. Once you are ready to fire, push the green button. You are now in firing mode. Squeeze the loop handle sequentially to deploy the staples and transect the tissue. Fire until the loop handle locks and the knife has traveled the complete length of the reload. Once the stapler has been fired, open the jaws by completely pulling back the black return knobs. Gently remove the stapler from the tissue. Before removing the stapler from the port, ensure that the jaws have been brought back to the neutral, unarticulated position. Close the jaws of the stapler and remove the Endo GIA Ultra Universal Stapler from the operative site. To unload a reload from the stapler, the articulating knob must be in the neutral position. Ensure that the jaws of the reload are open by completely pulling back the black return knobs. Pull the light blue unload button back towards the stapler twist the reload counterclockwise 45 degrees, and remove the reload from the shaft of the stapler. EGIAUSTND reloads with tri-staple technology come in 3 different staple sizes. Each size is intended to be used on a wider tissue thickness range. TAN reload has staple heights on 2 mm, 2.5 mm, and 3 mm on inner, central, and outer staple rows respectively, and is intended to be used on vascular medium tissue. Purple reload has staple heights on 3 mm, 3.5 mm, and 4 mm on inner, central, and outer staple rows respectively, and is intended to be used on medium-thick tissue. A gray 2 mm reload choice is also offered, but does not have tri-staple technology. This gray is typically used for small vascular bundles, as the closed staple height is 0.75 mm. For more information about Covidien EGIAUSTND Universal Stapler and Reloads with Tri-Staple Technology, please visit our website at www.tristapletechnology.com. Please refer to the instructions for use or the Covidien catalog for more information.